Hi, this is Lisa Miller, and welcome to my podcast, Selling to Healthcare. So, a little bit about me. I've been selling into healthcare for over 30 years, and particularly selling into the executive suite and into different leadership departments throughout a hospital and other healthcare organizations. And I want to share a little bit why I wanted to do this podcast, which my vision was to have like a Netflix series and really be able to go deep on this subject. And the goal of this podcast is to have about 5 or 6 specific individual podcasts talking about different subjects within selling into healthcare, really be able to provide value as so many people are wanting to serve healthcare. They have great products and solutions and they're struggling, and they really have great solutions to help healthcare and help patients. And yet they really are having difficulty getting their products sold. It's something that I had struggled with a little bit for a few years. And so in that struggle, I've learned lessons and strategies and tactics, and I want to share that with you today. So with me is Lisa Lauder, and I am going to let Lisa Lauder explain who she is and who she's been in my professional life.
Well, thanks, Lisa. Thank you for the introduction. My name is Lisa Larder, and I am Lisa Miller's strategic marketing advisor. I get to do all kinds of fun marketing initiatives with Lisa. We have cooked up some really, really amazing ideas for her business, for the business that she previously owned and sold, not to mention other companies that she has. And it is always fun to dream up big ideas with Lisa and then watch them come to fruition. One of the things that I get to do with Lisa on a regular basis is play the role of podcast producer. Our team does the production of the podcast, and I'm a regular on the show with a ton of questions that will be useful and engaging for you when you hear the answers that Lisa brings to the table.
Great. Thank you, Lisa, for being here. Just a little more background, and then we'll jump into the questions. I am the founder and former CEO of iHealthcare for 23 years. I led a consulting firm that helped hospitals reduce their non-labor costs. And previous to that, I'd worked for Stryker and a company called Cytodiagnostics. So this entire lifespan of working in healthcare, and particularly being a founder, and then later in 2022, I sold my business, really understanding those dynamics has really been very useful in really delivering the non-labor cost savings that I wanted to deliver because I knew what we were able to do. So a lot of what we'll talk about comes from that real life proven experience, right? Not theory and not done for only several years. It's really been over the course of over 30 years. So let's begin, Lisa.
Yeah, let's get started. So, my first question for you is, it is said healthcare is complicated when it comes to selling. So, can you explain to our listeners why healthcare is considered such a complex industry for sales professionals?
Yeah. So I want to start with some stats and not to get into kind of heavy numbers, but I think it does speak to the question. Yeah, I don't know if everyone realizes the massive amounts of dollars that goes into US spending. I think we talk about it, but to hear it, I think I mentioned it to you earlier and you were shocked. But the spend in total that the United States spends on healthcare is $4.3 trillion. That was in 2022. And so that gets broken down into some interesting areas, right? 1.4 trillion for hospital spending, and then physician and clinical services accounts for 850 billion, and then payers 1.2 trillion, Medicare 1.5 trillion. Say all that, how does this relate? It's the actual selling into healthcare. What does that mean for us who sell into healthcare? It's a $1 trillion business. So why does that matter? It matters because there's so much complexity. We're just trying to solve for so many things, right? We're solving for an aging population. We're solving for a lot of health issues we didn't have previously. And we're kind of high tech, right? We have this massive amounts of technology, and we're coming out with new ways to screen and help people with whether it's cancer or other issues. So we've got lots going on. And then let's take it into the hospital setting. Now you've got clinicians and operators, and how do they work together. One solution requires usually multiple areas within a hospital that has to get kind of buy-in, right? There's very rarely like one person that can be like, oh, I need that, I'll take it. It's usually intertwined significantly. And really, healthcare is. You think how a patient comes into a hospital, billing, into the procedure room, outside the procedure room, and into the floors. It is a very dynamic area. So a lot of departments are connected. So nothing really works in that way, a silo. So I also feel like there's so much changes going on, right? And how do we keep up with all those changes? So there could be regulatory changes. COVID certainly added a lot of complexity to it. And I think for those reasons, there's probably a lot more, but I think those are probably a really good place to begin, why it's so complex.
Absolutely. How do you think that selling to healthcare has changed in recent years? And what are some of the key shifts that salespeople really need to be aware of?
Yeah. So I'm going to kind of go from like most current and maybe go back a little bit, but certainly we sell virtually now a lot more, which
Mhm.
I have to tell you, I was a little surprised about. Obviously, during COVID and that in that time space, it made sense to do that, right? But now it seems that virtual selling has remained. And it's not just from the people's perspective that want it. It seems like the hospitals want that too. They can get together their teams a little easier. So virtual certainly has changed. And that really means that as salespeople, we've got to adapt. And I think we've done a poor job at adapting to selling virtually, have made that a priority to really be skillful at. And what do you do beforehand, right? What do you do during? What do you do after? How do you even look on the calls? Like, there's just a lot of dynamics. I think virtual selling is a big shift and it doesn't seem like it's going away. And I do think the counter to that is how do you get in front of your customers? But for right now, virtual. We have a lot more technology that hospitals need. We have labor issues. So, how does technology solve some of the labor issues? I think selling to healthcare requires an understanding of that. I think the other two other areas, again, this is one that I go really deep into in other areas, but how do we show an ROI when we're talking about our solution? So I think hospitals become more fiscally aware to say, oh, I'd love that, but explain that ROI. They've become more savvy on business cases. We might have heard of that in years gone by, but nowadays we're really hearing it more. And they're really wanting a strong understanding of how it addresses patient care and how is that fiscally responsible. And the other shift, I feel like they are just getting bombarded with messaging, right? Emails, calls. And I really feel like salespeople have to get out of the email cycle and do things differently.
Yeah, being differentiated is something you've always talked about.
It is because, for me, I was definitely willing always to try things, right? LinkedIn outreach, emails, I would speak, I would do webinars. I just felt like I was always trying to get my message out. And probably just straight cold email or email outreach, generally speaking, does not work. And I think it's becoming less effective. Now, that's different than having a useful newsletter, right? You and I have worked on a really useful newsletter where I've literally have given some case examples, put together something thoughtful, thanks to you and your team. We put it out to our list, and I've gotten reply back from a CFO, Lisa, I want to set up a call with you. And it just speaks to, I know we're jumping a little bit, it just speaks to the proof that the C-suite, they are looking to solve their challenges. They are looking, they know they need help. And what are you doing in a consistent way, in an interesting way, differentiated way, a useful way to get them information? So a CFO hits reply and says, Lisa, let's set up a call. I can't tell you how many times that's happened. So in that respect, having a really strong newsletter is probably a core principle that a sales rep could use. I know companies, corporations have it, but maybe the sales rep could say, this is my own personal newsletter. I work for whatever company, and here I have 50 clients, and I want to let you know what's going on in my company this month. And it becomes personalized. But I think that's a differentiated approach.
Yeah, absolutely. Absolutely. Professional selling is a skill that needs to be developed. What are some common misconceptions about selling that newcomers to selling to healthcare should avoid?
Yeah, I think the one that always stands out to me the most is this thinking, oh, I could be a salesperson. Like, that's easy. It's all about relationships. And don't get me wrong, relationships are super important, right? But selling isn't just, oh, I like to get on the phone with you and talk about the weather and where do you live and what part of the country. And I think that's a common misconception is like, oh, you have relationships, you're going to do good in selling. I'm not discounting relationships. I'm just discounting it in the form of skill-based selling. And so the misconception is it isn't a skill. Well, absolutely 100% is a skill. It's a skill that you've got to have a passion for. You've got to have a desire to learn constantly. You and I have had a conversation. I would love for us to have this conversation that you and I just kind of have riffed on in the past. We both come from sales, like retail sales, right? I worked for Open Country Shoe Store when I was 17. I think it might have started before 17, and we were taught how to bring shoes out. In this case, it were very expensive shoes. I was getting commission. I was working less than minimum wage, made a commission, and was taught how to do that, literally how to bring a box out and how to present it, and then bring a different pair of shoe that wasn't the same one just to present. And like, we were taught, we had sales training in retail, right? I mean, right, Lisa, didn't you have the same experience?
Yeah, I write about this in my new book, Making Bank. I call it the witch clothes, and how when you are selling, you need to be skillful enough to provide your buyer with options. And I think some of those skills were learned way back in the day. Like you, I worked in a retail store. I worked in a shoe store. I also worked for Lady Foot Locker. And you didn't just bring one top or one pair of bottoms to the fitting room. You brought several. You didn't bring just one pair of shoes out. You brought three, because you knew that the more options you provided somebody with, the more likely they were to buy. But you were also skillful in the selection of what you presented. I didn't bring a woman a man's pair of shoes, because that's not what she's shopping for, right? So there's a lot of skill and judgment in terms of how you actually show up and interact. And I agree with you, relationship building and establishing rapport is critical, because people won't buy from you if they dislike you, but they also won't buy from you just because they like you.
That's correct.
If you don't have the right product, service offering that is going to help them.
Correct. So what does that mean? Like, how does that translate from being a sales and retail and deciding on which shoe to bring out or how to present that? Why does it matter? It matters because when somebody comes in or you're talking to a customer, you have to be aware and observing, and you have to be prepared. Sales is about understanding your customer and not just getting stats, which I do believe stats are important before you get on a call and who you're speaking to, but it's about when you're on a call and you hear certain things, then you are able to say, okay, well, this is what I'm hearing, and be able to talk deeper. What one thing drives me absolutely bonkers is we've been taught to ask questions, and asking questions is great, but asking a series of questions, actually, April Dunfield talks about it in one of her podcasts. You ask all these questions because we're taught to ask questions, and then we go right into our sales presentation. Like, we don't connect the questions and then become an advisor and then customize what we're presenting based on the questions. We might have to skip over to slide 14. Oh, you know what? I don't think you need the first 12 slides. Let me jump, because here's what I heard you say. And I think, again, this becomes skill. And I think the other thing is, are we role playing? Do we pre-brief, debrief? Are we honestly debriefing, saying, I could have done better here, here, and here? Not everything has to be great. I think it's okay to say, if there was one or two things I could have done better, I think I would do this and this better. I don't think we do that these days. I think it's changed in that respect, but you can do it in a respectful way. So I could go on and on about
Yeah.
newcomers and professional selling and how important it is. But again, I go a lot deeper that in other areas.
Yeah. People need to understand the fundamentals of selling, and selling is really about helping your buyer make a buying decision. It's not about forcing them to do something. And I love what you said about listening to those answers. If you can't connect the dots, then it's probably you're not going to be effective at helping somebody make a buying decision because you're not able to actually demonstrate that you understand.
That's right. And they're really looking, and sorry, I'm going to jump in, but they really are looking for an advisor. I mean, we hear all these catchphrases, oh, I'm a trusted advisor, I'm a consultative selling person. And okay, but that has to be in real action. Like, how are you able to pivot and then change those questions, those discussions into here's some content for you.
Right.
But that requires sales skills, that requires that content.
Absolutely.
Yeah.
So speaking of content, can we talk about what you mean by insight-based content, IP, and methodology in your sales strategy? How can people leverage insight-based content, intellectual property, and methodology when it comes to selling?
Yeah. So this to me is almost like a core principle of what I did at Vi. And frankly, what I really learned at my first company, Cyto Diagnostics, was an amazing woman in marketing, created some great content for us, but taught us how to make that content useful and integrate it into sales conversation. And her name is Bev. And I was very fortunate. I had some great sales leaders and trainers early on, even before I started Vi. And they were of service. We were teaching and educating. They really taught us how to translate that into meaningful content and knowledge to our customers. I'm going to bring it fast forward to recent. I love the Challenger book. There's many reasons why I love the Challenger book, but there's one aspect about kind of giving what they call commercial insights. I call it insight-based content, but I'll give you one of their examples, one of my examples, and why it matters. So they were working with Grainger, and Grainger was having a tough time differentiating. Think about it. They just sell commodities, right? You can't differentiate tools and those kind of facility supplies. So how could they do that? What they ended up doing was they found out that companies were constantly buying what they called unplanned purchases, because Grainger might have been a little more expensive here or there, but we all know the big book that kind of sits on your desk. But organizations were trying to buy from smaller local other companies, but they were having now to do this more often. And what was happening is they were making these large unplanned purchases. They'd run out of a little part for a motor. And instead of buying one, they'd buy three. And it had all these downstream impacts. They highlighted this. So they found an insight in their customers' purchasing that they brought out. Like, you've got this unplanned purchase. How many times do you buy three things instead of one? And now look at all the downstream. And then their customers like, oh my goodness, that happens all the time. I've got this massive room of things that I only need one of. Now we have 15 of each. And they brought an insight out. So you can bring an insight out into your own experience, like you have in your own company. Like, this is what our customers say. And then you get the head nod. So I'll bring that to kind of some examples from my experiences. I had found some research. It was real, might even from the JAMA research, about physician cost awareness and how physicians that were given cost data just by looking at what they used and the price reduced their cost by 7%. Physicians that never received the cost information, this is in surgery, they had an increase in cost by 6%. So basically, just by showing cost, not dictating, not influencing, there was a shift of 13%. And that really helped me show the value that physicians will collaborate. Like, everyone says, oh, maybe they're difficult or they don't. Well, actually, they will collaborate because the studies show they will. You just have to give them some data. They're scientists and they want to collaborate. That was helpful in our approach because we were very successful working with physicians, because I always came from the perspective of, if you give them the right information, they will work with a hospital. Maybe they're just not getting the right information. So again, why does that matter? It matters because companies need to start either finding research that they can use that matters to their business, or if they've seen patterns in their own business, then they could talk about those patterns and share that with other clients, because you'll get head nods. I mean, I can't tell you how many times I would get a head nod like, oh, did this ever happen to you? Have you ever, had a manual review, and how long has that taken? Like, oh, it takes a long time. So I think that it's really important to have those insights, to have specific a three-part process. Like we used to have ROI, but we said reconciliation, optimization, and intelligence. We had a different twist on it, but we explained it. So again, it's such an important topic. This to me is a core strategy, because you could use insight-based content, your own IP and methodology. That's an enormous differentiator.
Absolutely. Can you break this down for me? Be a voice, build trust, and provide evidence. How can salespeople establish themselves as trusted voices in the healthcare space by thinking about being a voice, building trust, and providing evidence?
Yeah, I know I've been giving like really long answers on these, so I'm gonna try to shorten them, but I'm very passionate about what works. I see companies and people struggle. The good news to all this is that I certainly speak about it more, write about it, and people can get more information. On this one, I'm probably gonna, I'll skim it a bit, Lisa, because this is a big topic, right? So I think when I say be a voice, you've got to have your own point of view. I certainly have had my point of view with wherever I work, not in a negative way, but my point of view is that I see this business as such, and I believe in it. These are the reasons why I believe in it. I think it's important. I often hear people like, oh, I'm shy. I don't like what I look like on camera. I don't like what I sound like. And I get it, like all of the above for me. I say the things I want to say and get it out there. And you know what? I don't worry about the rest of it. I do my best. And I think people, companies, founders, executives need to have their voice and practice it. Look, I'm a lot better than I was several years ago, thanks to you. And you coach me on this. Like you've really have helped me be more comfortable in this space. And it's practice. It's like we often say, we got to do these uncomfortable things, right? Either in practice or in public, and just get better at it and be authentic. So be a voice. You got to get your voice out there. Writing voice, podcast voice, video voice. What do you believe? People want to hear it. I think the other areas are, how do you build trust? Build trust through mini case examples. Here's what I've seen. This is what's worked. Large case examples. Walk somebody through what work you've done. And if you're just starting out, you might have to use some research, or you might have to do some things in different ways, but you got to build trust, because you've got to support what you're saying. And particularly healthcare is an evidence-based environment. So we are dealing with people who like research, clinical documentation, case studies, probably more than any other industry.
Mhm. Would you say that responsiveness is important when it comes to building trust as well? I mean, you and I have had conversations today about how so many sales organizations are almost apathetic when it comes to their customers. How do you think responsiveness is impacting trust when it comes to selling to healthcare?
Yeah, that's a great question, because I this just actually happened to me. I often get, and I just got it, like, oh, wow, you responded so quickly. And I'm like, oh, okay, well, that's just my normal course of business. I didn't think I did anything spectacular, but I think responsive is key. I also think that how you respond is key, and what value and speed is so important these days. Speed to trust. And we talk about speed to value, but speed to what you're delivering. But I do feel that how you respond, how quickly, in what manner you respond, you're giving people an insight in how you're going to work. I often say, we're making a presentation, but people are deciding, do I like this person? Can I trust this person? Will they do what they say? Are they easy to work with? We're going to address this a little bit later, but they're going to make some big transformational decisions about things that they have to get done. And they're thinking, am I putting this in this person's right hands? Because it's going to reflect on them. And I don't think we think about that. So responsive is, yes, this is so important, Lisa.
Can we talk about being a best kept secret in the context of healthcare sales? How can salespeople increase their visibility ethically so that they are not a best kept secret?
Yeah, this was my own personal frustration, which really led me down the road of making sure that didn't happen because I started to hear that. Like I would hear, "Oh, you're like the best kept secret, Lisa." And I'm like, "Oh, that's great. I love it, but I really don't love it." And that it was my struggle. And so I had that frustration. I think it's really important that we've got to get educational content out. And how do you get that out in multiple ways? And how do you, kind of, speak in areas where your customers are? How do you write? I think AI is very powerful and very useful. However, I do feel like people have to think on their own, take their thinking. Yes, they can use AI, they can use tools. I think that's important, but the general thinking comes from being on the front lines, being able to see those insights. AI is not going to be able to walk through the walls of a hospital or through your customers and their problems. You need to think, you need to write, you need to connect the dots. You can then tweak and get some better wording through AI. But I think overall, not being the best kept secret is about, I think, thought leadership. It is about speaking, getting out in the marketplace, and it being bold. Like you may have to say things not disrespectfully and not to insult somebody, but you may have to be bold in getting some of your opinions out. Like we believe a hospital shouldn't X or should be able to do Y and be their advocates. I think this is an important topic because I think a lot of companies I speak to, they feel like they're the best kept secret. They're going up against the giants,
Mhm.
but I think it's thought leadership.
So, along the same vein, I have seen people when they're selling into corporate make the mistake of only building a relationship with one buyer. And
Mhm.
then if that individual leaves an organization, they are quickly replaced when a new buyer comes in.
Mhm.
Given that there's so much virtual selling going on in healthcare today, how do you advise sellers to get connected with more than just one person inside of hospitals and health systems?
Yeah, that's another really great question, Lisa, because I see it happening a lot and I've done it. And I think it's a real big watch out because it does happen, right? You focused on one person in the organization, and maybe you do listen, either A, you focused on one, the sales close, which has happened to me, and then they leave and that's it. Now you got to re-pick up. And that's happened. Or you've focused on one person, you've gotten in through that door and you've started, they leave, and now you probably are going to get replaced unless you've been able to reestablish yourself. But I'm a big believer in, let's say there is the one door. So I'll give you two scenarios. One door you get in, I think you're going to have to quickly be able to make relationships, make yourself valuable to more than one person, because more than likely you're selling a solution that's going to touch more than one person. I have been in engagements where I've walked through the door through the CFO, but then I had relationships with other people in departments and the CNO, and I've built my relationships out and I've been of value to them as well. And I've had that CFO leave, and others, like the COO or others, have wanted to continue to work with us. And they have left, gone to new places, and guess who they call?
Mm-hmm.
They call me because I have made myself valued through the organization. The other point is, as you're selling into the organization, I think a big miss is being comfortable enough to have different entry points, go into departments, go into multiple points, and then be okay to say, I'm also having a conversation with John in the lab, and they're aware of our solutions. Or we've talked to the strategy office because there's some implications for strategy. Why aren't we comfortable going through multiple points? I think that is a question everyone
Mm-hmm.
needs to ask.
Yeah, and or inviting different stakeholders to the table.
Correct.
If you have those insights and you know that the solution you're providing is going to impact multiple departments, you should be inviting those stakeholders to the table and sharing those insights collectively.
Absolutely. That's a great point.
So Can you talk about perspectives on competitors, creativity, and closing? How do these elements interplay in healthcare sales specifically?
Right. Big topic, but I'll cover it, give you the 30,000-foot answer. I think we need to understand our competitors really deeply. For all the companies, frankly, whether it was Cyto, Stryker, or my company, Vi, we were constantly understanding our competitors' strengths and weaknesses. And we were always taught, and I continue to teach that, never say anything bad about our competitors at all. Focus on your strengths and differentiators and what you uniquely can provide. I think it's a great approach. But I don't feel like we do enough of A, understanding, and B, I know for me, particularly when I was at Vi, I was overly paranoid. And there's some good in this context, that's good. They're going to be developing and innovating. Like just because I knew what they did a year ago does not mean that what they do now is the same.
Mhm.
So I was constantly understanding my competitors' current day and keeping a hold on understanding. The second part is creativity. You're an example of creativity in my life, right? Like you said, we got to do fun things, and it is fun, but I want to bring that creativity to my clients, right? So creativity in how I communicate,
Mhm.
market to help them, creativity into helping them solve problems. So I think we have to do that as well, right? As
Mhm.
we're selling it to.
And creativity isn't always fun. Like sometimes it's really, really, really hard work.
It
And
is.
so, I want to stop you there because
Good point.
I've worked with you for many, many years now. And the one thing that I've learned from you is the surface idea is rarely the creative idea that you go with.
Mhm.
You will stick with something and really, really work on it and do the hard work of figuring out how to differentiate before you move forward. So I just don't want listeners to think that creativity, oh, it's fun, it's easy, it's simple. It takes a lot of
No,
work.
yeah, no, it is hard if you're going to do it in a really differentiated way. Yeah, it is. And you're not going to do it in a bland way like everybody else does it. So I remember when I was trying to come up with the name of my patented technology, which became Invoice ROI, I wanted to attach it to an invoice. I loved ROI. I couldn't figure, I got reconciliation and optimization. I couldn't figure I out. And it just was driving me crazy. And I know it may seem later now obvious, but I couldn't figure out the I, and I just was so frustrated. Like, and you and I have had these conversations like, no, that doesn't work. It doesn't work. And I wanted it to be, I wanted to have meaning to why that technology was created. I just didn't want a surface meaning. I wanted a deep meaning that I could explain. But anyway, it ended up being like at 3 a.m. in the morning. I popped up and I'm like, intelligence, it's intelligence. So I got it. I can call it invoice ROI. But it's a lot of hard work. And who's doing that hard work that cares enough, that wants to make the connection? So thank you. I didn't want it to seem like we were just like hanging out, being creative. No, that's not what I meant at all. But I do feel like creativity can be fun in some respects. It is hard and it's got to be meaningful to the customer because if it
Yes.
isn't, and then closing. So this is a big topic about how we close. Ultimately, we are selling, but we're in a service business. Remember, all of healthcare is around patient care, either patient care or helping families. I think we have to remember that. How we close, I think it's about going back to the nature of servicing and serving. And maybe we don't look at the big deal all at once. Maybe we look at trying to get a smaller deal, be willing to give someone an evaluation, a try. I just think there's so many aspects to closing these days and we have to be thoughtful about it because they're taking a big risk on a lot of companies. And how do we de-risk that for them?
Hmm. Absolutely. So, Lisa, I know you are a really big believer in ride-alongs when it comes to selling so that you can observe how people are approaching their sales presentations. Can you share with us some of the common pitfalls or mistakes that you see salespeople make when they're either new to selling in the healthcare industry or maybe they're just too comfortable selling in healthcare?
Yes. So I think there's a few of those, Lisa. I think one is being comfortable selling maybe lower in the organization. And I don't mean any disrespect by that, but ultimately we're selling for someone to make a decision. So I think the mistake is maybe selling to leaders or executives and being comfortable there. So I think that's number one. And not that there's not value in getting consensus, but sometimes we're comfortable with we're happy with getting a call, but that call doesn't mean there's going to be a decision maker or outcome. So I think that's number one.
Mm-hmm.
I think number two is how we orchestrate a sales presentation. We've been told to ask questions, and then we go into our presentations. I think if you're going to ask questions, might limit them to one or two. Agree to take a presentation call with you, like present, and then incorporate some of those questions or maybe ask them at the end. But I think we need to do a better job at, like, if you're going to ask questions, then you're going to have to be fluid with the presentation. And then thirdly, what do we do in the beginning of our presentation? The reality is we spend so much time talking about us. And I think it's just too much wasted time, like a little bit, and then really let's get to the why I think I can be of service and help you. And then you can validate. And I think those are probably the misses. The only other one is, I think, deep understanding of healthcare. I was taught early on to really study at night. Like, we were selling in the day and we were coming home and we were studying. And both
Wait a minute,
companies.
you had to do work outside of work hours? Is that a thing?
That was the thing. That was the thing.
That's how you built your career back in the
Yeah.
day.
Yeah. So I was out all day, Monday through Friday, on sales calls, driving appointments, came home, ate dinner, and then studied. And that's what I thought the business was about. Like, I just thought that was life. And it didn't mean I didn't have fun. I had a lot of fun in my 20s, and I managed to do the things I wanted to do. So I'd have to read research articles. I'd have to be able to learn more. And guess what that did? That enabled me next morning to have new insights, new understandings, have better conversations with clinicians and leaders. So what I find today is, I don't think I'm anything extraordinary. Like, I love healthcare. So yes, I am going to read and immerse myself in it, but it's something everybody can do. Like, I'm not extraordinary. So when I get on a call and I'm talking about a topic, but I see the topic relate to revenue cycle, or I see the topic relate to social determinants of healthcare, I can pull those patterns in and have a better, useful conversation. And now I become the expert. I'm really the expert because I've chosen a field that I want to really have a deep understanding. So a newcomer, you can start by reading journals or daily summaries, but you're really going to have to immerse yourself. If this is the business you want to be in, then be useful.
Mm-hmm. Absolutely. All right. So the next podcast in the series is called Selling Margin and Mission. Can you talk to us a little bit about the concept of selling margin and mission and why this is important in healthcare before we wrap up?
Yes, so I'm really looking forward to the next podcast and talking about this whole idea of margin and mission, because that's the crux of healthcare these days. When really it started with a nun, her name was Sister Irene Krauss, and she was basically oversaw 80 hospitals as a president. And so she was really the person who termed that, without a margin, there's no mission. She termed that because she was part of Sisters of Charity, and they had a certain amount of charity care, but then they need paid care. So there's a little bit of a backstory to that. But she was an advocate of the benefits of fiscal responsibility. So I feel that this is such an important topic, as people selling into healthcare need to understand that balance in how they sell. So I am really looking forward to these other podcast episodes. Episode 2 is Selling Margin and Mission. Lisa, thank you very much. This was a longer first episode because there was so much to cover, but we've got some really interesting topics to cover and continue on this Netflix series.
Yeah, our Netflix mini podcast series. So for those of you listening, it's really important that you kind of go into all 5 episodes. So episode number 2 is going to be Selling Margin and Mission. Episode number 3 is going to be Selling to the C-suite in healthcare. And episode number 4 is going to be Selling to physicians and clinicians. And then episode number 5 will be Selling to supply chain and department leaders in healthcare. So this particular episode was really kind of a high level overview of selling in healthcare. The next ones are going to go a lot deeper. And so it's important that you listen to the whole series if you want to master your sales in healthcare. Lisa, any final thoughts as we wrap up today?
The only final thought is it's been a vision of mine to go deep in this area. If anyone wants to reach out to me, all the information is here in the podcast notes and on my site, lisatmiller.com. I think that this is going to be very relevant and useful, and I'm excited to continue. And again, if anyone wants to reach me, you can via my website. And also I have an upcoming book called Selling to Healthcare, which I'm excited putting that together, but lots of resources that will be coming out, including a newsletter. It will be a private newsletter, and there's more to follow on some of the solutions I'll be getting out to marketplace to help companies. So thank you, Lisa, for your time today. And this was a great episode.
Thank you, Lisa. And for those of you listening, you can find Lisa at lisatmiller.com.
Thank you.